Dr. Piskin, what does holistic dentistry really mean? Can you tell us?
Well, it's all different definitions, and, everybody has their thoughts of what it really entails, but holistic dentistry is looking at the whole body and not just the mouth. So when we do holistic dentistry, we want to see what is it we're putting in the mouth and how might it affect their whole body. Are they eating right? Is their nutrition right? Is their health right? We talked about gum disease at one time, Helmut, how that affects the body. So holistic is a whole approach. So even when we talk about, some people think holistic dentistry is related to silver fillings or mercury fillings, the poison that we have and that they had made when they use silver fillings. I don't use silver fillings. I haven't in 23 years done any silver fillings. We have great alternatives with composites and tooth colored and materials that strengthen the tooth and not cause the tooth to break apart. And of course, they don't have any toxic stuff in there like mercury. And silver fillings, you component of metallic and silver and metals, and it would be mixed with a mercury in a little capsule, and we mix it up, and then we'd shove it into the little holes in the teeth after we drilled out the cavities. So there's still a controversy as to the safety of that. I don't choose to offer that to my patients, so we do have alternatives. So that's part of holistic dentistry, what we put in people's mouths and what would I want in my mouth. And that's what I choose to give to my patients as well.
Wonderful. Now, Doctor, okay, so that's well explained what holistic dentistry is. Basically, just as it says, take care of the whole body. Now, let's assume a person he comes to you and he has silver fillings in. Does it necessarily mean he must take them out or not necessarily? Can you shed some light on that?
Sure. If the silver filling is doing well, and there's no signs of tooth decay around it, and the margins where they meet the tooth are sealed, there's no reason to take it out. I ethically do not recommend doing that, and the Federal Drug Association says you cannot say that to patients. You can't take out your silver fillings just because there's silver fillings. If a patient wants to take them out and they insist, then of course, but they need to know that other things can happen when you take them out. But no, I do not take them out if the silver filling is good. I only want to make sure I tell patients I offer alternatives. And in my office, I do not offer replacing silver fillings with silver fillings. I do not do silver fillings. We have ceramic fillings. We have composite fillings. Those are the big choices today. And, of course, there's still the standard, which is gold, if they feel that they want to have something like that as well.
Okay. Now, you said that if you take out a silver filling, a patient needs to be aware of what could happen. What is that, what could happen? If you have a silver filling and you're taking it out, something could happen, you said. So what is that something?
Well, when you put it, when the silver fillings were put in at one time, the hole had to be big enough to hold it in. Even though the cavity might have been a tiny little dot, they had to drill a big enough hole because the silver filling didn't bond to the tooth, didn't attach to the walls. So usually a lot of the tooth structure has been removed already just for the silver filling. Now you start removing the silver filling, and now all of a sudden the hole gets bigger. And now all of a sudden you have weakness in the tooth, and the toothaches can develop cracks. So if you're going to take silver fillings out, you want to put in something that's going to make it stronger. And the bonded fillings bond to tooth structure. We actually can make the tooth stronger by replacing the silver filling if that's the choice. But don't just inadvertently take out silver fillings because they're silver. You should know that it could cause other damage. And every time you drill on it, sometimes the tooth is going to be a little unhappy. And all of a sudden, it might say, you've drilled on me enough. I'm now going to be unhappy and start to give you some discomfort. And other things might need to be done, like a root canal. So we don't like to drill if we don't have to. But if it needs to be replaced, we do have great choices today other than silver fillings.
Basically what you're saying, if it ain't broken, don't fix it.
Well, in some cases, you'll see silver fillings in teeth, and you'll see things developing. Now, you might see little cracks developing. The silver fillings actually start to expand over time, over years, and all of a sudden, you see things that are happening even though the tooth might not have broken yet. So being proactive in cases like that is the way I take the approach. Is I'm not going to wait for the tooth to break. if I see things happening. So if it ain't broken, don't fix it, and that's not a great approach. If I see things happening, let's replace that silver film with something that's going to prevent that tooth from cracking and maybe even causing the tooth to be lost if it cracks unfavorably in the wrong place.
Right. Well, I was more referring to if the filling ain't broken. If it's all perfect, if the margins are fine, if it's all fine, leave it.
Yes, absolutely.
Yeah.
If the tires are good, we don't need to replace them.
Wonderful.
I'm more conservative I'm very conservative when it comes to that. Yes, if it's doing well, let's keep it that way, and we'll just keep an eye on it.
I'm sure your patients will appreciate that. Thank you very much, Dr. Piskin.
You're welcome.